40% of U.S. adults are obese. By now, you know of the new class of drugs. Some focus on type 2 diabetes. Others focus on weight loss. But many now face a supply shortage that's worrying patients.
I've gotten a second chance at life, and I'm not going to mess it up.
I think what we are all learning very rapidly is that managing obesity and targeting obesity is going to become a central factor in practice of medicine.
We talked to a doctor studying these drugs, a patient taking Ozempic, a professor who studies the role of supply chain, a professor who studies the role of insurance, and a nonprofit pharmacy director.
This is my past.
Jackie Long's past is unrecognizable to her now.
Before I couldn't. I was hardly mobile. I wanted to sleep all the time. I wanted to eat all the time. I didn't want to go anywhere. It just hurt to move.
She's battled diabetes and major heart problems all her life. Her doctors at St. Luke's Mid-America Heart Institute in Kansas City said even her open heart surgery and weight loss surgery weren't enough.
I remember getting my master's degree, walking across that stage, not as proud as I should have been, because I couldn't hardly walk across the stage to receive an honor that I worked hard for, because I couldn't hardly breathe.
Then one day, a cardiologist at St. Luke's told her about his clinical trial. She'd take weekly semaglutide injections, commonly known as Ozempic or Wegovy. The results were life-changing.
I've gotten a second chance at life, and I'm not going to mess it up.
It's why Dr. Mikhail Kasibarad took her into one of his clinical trials.
Obesity is not just an accident in these patients. Obesity is what actually driving the development and progression of heart failure. And in order to treat heart failure in these patients well and effectively, we have to target obesity.
His trials were for overweight or obese patients with either heart failure and diabetes.
For this particular outcome, the symptoms and physical limitations due to heart failure, it's the best results that we've gotten with any medication in this type of heart failure so far to date.
Are these weight loss drugs the future of medicine?
I think what we are all learning very rapidly is that managing obesity and targeting obesity is going to become a central factor in practice of medicine.
Targeting obesity could be the answer to countless health epidemics, but that's not the current reality.
Ideally, if cost isn't an issue and supply chain and having enough medication around is not an issue, it becomes a different discussion, but that's not the world we live in right now.
That's what UMKC supply chain management professor Larry Wigger studies.
Oh, there's definitely a supply shortage.
Dr. Wigger says the attraction to losing weight has increased the demand for this class of drugs.
Demand's through the roof. They're trying to get production cranked up, and that's why we have a supply shortage, because that demand is just outstripped.
He believes drug makers will catch up.
If we can get diabetes under control, we'll improve things, we'll improve health outcomes, we'll lower healthcare costs. I mean, it's awesome, but that's a whole different level of demand.
But that level of demand comes with a price tag of its own.
When you have a drug like Ozempic, my understanding the list price is around $1,300 per month.
Christopher Garman looks at medical costs and health insurance plans in some of the classes he teaches at UMKC.
There are some employers that will cover these drugs for weight loss, even though Medicare won't, Medicaid won't, and a lot of private insurance won't, just for weight loss.
Medicare Part D patients can get coverage for weight loss drugs as long as there's an added health benefit. According to the KFF, states decide whether Medicaid patients are covered.
If they really reduce obesity, that could lower healthcare spending in the future, and that could benefit insurers in the future.
Christopher says more research is needed on the long-term effects of covering these drugs, but patients who are underinsured don't have time on their side.
Some of our patients who, may only be paying a couple dollars for a prescription would be looking at about $1,000 for those that, may be available.
Michael Fink is the pharmacist in charge at Pharmacy of Grace. The nonprofit serves patients who are uninsured or underinsured.
You know, when we're trying to supply a patient with these medications and they're not available, moving to an affordable product isn't always an option for them.
He's watched awareness of weight loss drugs impact his patients' prescriptions for diabetes medications.
Patients are desperate to find, you know, whether it is for diabetes or for their weight loss, just to maintain and, you know, reach the goals that the doctor and they have set.
Hope to never fit in them again.
Obstacles and all, these drugs are just one way people are searching for a happier, healthier future. Elise Schoenig, KSHB 41 News.